Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
Today, I will summarize a review paper titled Complete Percutaneous Coronary Revascularization in Acute Coronary Syndromes with Multivessel Coronary Disease, a systematic review. This was published in the Journal of the American College of Cardiology, JACC Cardiovascular Interventions on October 16, 2023. The first author is Dr. Denise Cristiana Ferro from the University of Catania, Italy. Multivessel coronary artery disease affects about half of the patients with acute coronary syndromes and is associated with poor outcomes and high mortality. It is challenging to manage and make decisions about, and research on the pathophysiology of unstable plaques and local or systemic inflammation is ongoing. Complete revascularization is beneficial for hemodynamically stable ACS patients with multivessel disease, and guidelines provide some guidance based on strong evidence for ST segment elevation myocardial infarction and less strong evidence for non-ST segment elevation myocardial infarction and cardiogenic shock. However, some unanswered questions remain, such as the optimal timing for complete revascularization and the best guiding strategy for intermediate stenoses. In conclusion, multivessel coronary disease in acute coronary syndrome is a complex condition that challenges clinicians and interventional cardiologists. While guidelines provide clear guidance for patients with ST segment elevation myocardial infarction, with multiple trials supporting the benefits of complete revascularization, the evidence base for non-ST segment elevation myocardial infarction and cardiogenic shock is less robust, relying on a single randomized trial for each condition and some observational studies. Further randomized trials are needed to determine the optimal timing and guidance strategy for complete revascularization in these patients. These trials should consider the potential benefits of personalized approaches and incorporate comprehensive evaluation by a heart team.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.